Well, I was experiencing the flu-like symptoms for a few days, and I woke up one morning with some chest pains and nausea, and I thought I needed to get it checked out since heart issues run in my family. And they conducted a series of tests. Dr. Garza was the doctor on call, and they were very, very thorough with their testing. And once they received all my tests back, he came in and told me that everything looked okay as far as not having any type of heart issues. But in conducting the CAT scan, they found a mass on my pancreas, which could have possibly gone undetected for a while. Had Dr. Garza not conducted that CAT scan, the tumor on the pancreas could have gone undetected for quite some time. So he basically saved my life that day. And he was gracious enough to contact my primary care physician to get me a doctor's appointment. He also generated the orders that I needed for testing. And so this was all new to me. This was a really complete shock to me, considering that 95% of people diagnosed with pancreatic tumors are in stage 4. So I was very, very lucky and blessed, and my surgical oncologist told me that I should be very blessed and grateful that the doctors and staff at Patients ER found this tumor, because otherwise I could have been in the 95%, and I was lucky I was in the 5%. I came here, it was a divine invitation for me to come here, and the thoroughness of his testing, his bedside manner, and his true concern for what he did for me, and he basically saved my life. And I want to pay it forward, because I think it's important, if you cannot get in to see your primary care physician, that there are alternatives. And Patients ER has been an alternative for me, even after I've gone through my Whipple surgery and the pancreatic issues, that I've had. There's a need for freestanding ERs, because when you go to a traditional ER, you're in the waiting room for hours, not just 2 or 3 hours, but for 6, 7 hours. And you don't get the results, you don't get the testing that you need. It's just, you're treated like it's a revolving door. When you come to a freestanding ER, they take a personal interest in you, and you get serviced almost immediately, and you get the results, and you know where to go once you leave. I knew I was in good care here until I could get into the hospital, and I was in the hospital a week. But other ERs would either send you home, or you would be waiting 2 and 3 days in an emergency room, behind the sheets, whereas a freestanding gets you where you need to go a little bit quicker, or actually a lot quicker. I use Patients ER as my go-to for, especially since what went on with me, because they do have my records. Not that I don't like my primary care, I do. But if I need to get in quick, this is where I'm going to go, because I know I'm going to get the best possible care out there.